Hey guys, welcome to Southern California EMS Training Institute. My name is Tyler. Today we're going to be going over medication administration and our 6 rights and DDICE. Our 6 rights and our DDICE are in place to keep us from making a medication error. People die in the hospital setting because doctors, nurses, paramedics, and EMTs make errors when administering a medication. So please, please, please double check, triple check your medications before you go ahead and you administer them. You can't give a medication, but you can't get it back, right? Once you give it to them, it's gone, right? What's going to happen on the body is going to happen on the body. So make sure that you double check your medications prior to administering. And that includes things like allergies. Allergies is the one question I don't mind asking multiple times to a couple patients, right? Again, just double checking you don't have any allergies, correct? I know it gets kind of, repetitious for a lot of your patients, but it's good to make sure that they don't have any allergies to the medication that you are about to administer to them. So in order to keep us from making mistakes, we go through what we call the 6 rights and your DDICE. Now, your book only talks about 5 rights, but because you go to Southern California EMS Training Institute, we're gonna make you learn one more. So your 6 rights include right patient. You have to make sure that your medication is indicated for your patient, or in the case of something like nitroglycerin, is prescribed to your patient. We want to make sure that it is to the right patient. We also want to make sure it's the right medication. Double check, take a look that you grab the right medication, you grab the right vial, just to double check that you got the right medication you're going to give for your patient. So we have your right patient, your right medication. Your next right is your right route. We do want to give this patient the right medication, but via the right route. Some of the medications, as you progress through the healthcare field, will have multiple routes. We want to make sure that the route that we're going to give this medication to the patient is the correct route for what we want to give it for. Next thing is the right dose. We want to make sure that we have the right dose of the medication. It's very easy in the medical field to potentially overdose or underdose your patient. So we want to make sure that when we administer this medication, we're going to give them the right medication via the right route, and we're going to give the right dose to our patient. After we've done those 2 things, our last 2 rights is the right time. We want to make sure that we've given the medication at the correct time. So for instance, if I'm giving my medication, let's say at 2 o'clock in the afternoon, right, I want to document that, because if I can re-administer a medication maybe at 5 minutes, I want to know that the next time I can give that medication is at, let's say, 2:05. So we really need to be documenting and recording the times appropriately to make sure that we don't give them too much too soon, or maybe miss when we were supposed to re-administer another dose. And then lastly, documentation. We need to do correct documentation for when you administer a medication so that we can follow up our care at the hospital. So our 6 rights, again, are right patient, right medication, right route, right dose, right time, and right documentation. Remember, check your 6 rights before you administer medication. That might look like something like, my patient, right? This is my nitroglycerin prescribed to my patient. I know it's going to go sublingually, 0.4 milligrams at 12:50 in the afternoon, right? And I'm going to make sure I document appropriately. But you need to do that before you administer medication. Double check and triple check. Lastly, our DDICE. Our DDICE stands for drug, right? Again, making sure we have the right drug. And then dose, making sure we also have the right dose. Like, wait, didn't we just check those in our 6 rights? Why do we have to recheck them again? To keep you from making a mistake, right? We don't want to make mistakes in the field. We don't want to do damage to our patients. So please, please, please double check. So our DDICE stands for drug, dose. I stands for integrity. How does the integrity of the package look? Does it look like it's in good shape? Would you administer this medication to your family member, right? Has it been rolling around maybe on the floor of the ambulance, or maybe shoved in the bottom of your patient's purse for a long time, right? What does the integrity of the package look like? Some medications are liquid in form, and so our C stands for clarity, right? Is the medication clear, right? Is there little things floating around in it, or is it brown when it's supposed to be clear, right? That would be a medication maybe I wouldn't want to administer to my patient because I don't think it's going to work, or it might do some harm to my patient. So we check, again, the drug, the dose, the integrity, the clarity of the medication, and then lastly, the E stands for expiration. What is the expiration date? You can see that sometimes in the pre-hospital care setting, we'll actually write it in big, bold letters with a Sharpie to make sure that we don't miss it. But if this were a patient, you'd actually have to find, right, on the expiration date on the container. So make sure you're checking for that expiration date. We should never be administering expired medications in the field. Remember, do no harm to your patients. So again, you guys, this is your 6 rights and your DDICE to help keeping you from making a medication error in the field, right, and making sure you don't do any harm to your patients.